Baltimore General, an episodic medical drama. Written by Blue Bolton. Episode 1, Transfer of Care, Chapter 14. Emilia sagged against the wall outside the CT suite, her gaze locked on the double doors that had swallowed Jordan. Fluorescent lights hummed overhead, casting shadows across her face. 24 hours into her new job, and she'd plunged headfirst into a medical nightmare. A 16-year-old boy lay inside, his body betraying him, paralysis creeping upward, blood seeping where it shouldn't, organs surrendering one by one while they grasped at invisible threads. She let her eyelids fall, Jordan's symptoms swimming behind them. The pieces drifted like debris after a storm, the crimson stains on his hospital gown, the violent jerking of his limbs during seizures, the liver enzymes screaming distress, the stillness spreading through his body, each symptom more sinister than the last, each development dragging them further into uncharted waters. Carter? Her eyes snapped open to find Shaw looming before her, tablet clutched in long fingers. Shadows pooled beneath the surgeon's eyes, exhaustion etched in the tightness of her jaw. CT's almost done, Shaw said. Neurosurgery's on standby. Emilia straightened her spine. Any change? Number still completely unresponsive. Shaw's finger glided across the tablet screen. Lab results are back. Liver enzymes are through the roof. AST 1200, ALT 980. Jesus, Emilia breathed. The numbers painted a picture of a liver in catastrophic collapse. What about coags? INR 4.8. Platelets still under 20,000 despite transfusions. Shaw thrust the tablet into her hands. Take a look. Emilia's finger scrolled through the cascade of numbers, each value worse than the one before. Creatinine climbing toward the ceiling, bilirubin soaring, ammonia levels refusing to retreat despite their best efforts. His body's shutting down, she murmured. System by system, Shaw confirmed, voice flat. Question is why? A technician pushed through the CT doors. We're done. They're taking him up to ICU. Shaw nodded. We'll be right there. When the technician vanished, Shaw's eyes locked onto Emilia's. Differential room. Now we need to figure this out before there's nothing left to save. The differential diagnosis room stood empty, waiting for them. Shaw strode to the whiteboard, the marker cap flying off with a sharp crack. Let's start from the beginning, she commanded, writing Jordan Hall 16 in bold strokes. Her hand moved quickly, listing symptoms: hemorrhage, seizures, thrombocytopenia, elevated ammonia. Emilia stepped beside her, the scent of marker filling her nostrils as she added, liver failure, bilateral arterial occlusion, ascending paralysis. OTC deficiency, Shaw's marker squeaked. Vascotril overdose, Emilia countered. They retreated from the board, eyes scanning their work. This isn't just OTC deficiency, Shaw muttered. And it's not just a Vascotril overdose. The combination could explain some symptoms, Emilia said, gears turning. The ammonia levels from OTC, the bleeding from Vascotril's anticoagulant properties, but not the arterial occlusion, not the rapid liver failure. Shaw's marker tapped a staccato rhythm against her palm. We're missing something. Emilia's eyes drifted closed, her mind rifling through medical school lectures, residency cases, years of ER diagnoses sorting, discarding, searching. What if, she began, words forming slowly, what if the OTC was a red herring, or at least not the primary issue? Shaw pivoted toward her. Go on. His ammonia levels were high, yes, but what if that's secondary to liver failure, not the cause of his symptoms? What would cause acute liver failure in a 16-year-old? Shaw's marker squeaked as she wrote acute liver failure, etiology, on the board. Viral hepatitis, Emilia offered. Serology was negative, Shaw fired back. Drug toxicity. Beyond the vascutrill? Emilia's shoulders rose and fell. Possibly, we should run a broader tox screen. Already ordered, Shaw said. What else? Autoimmune hepatitis. Doesn't explain the vascular symptoms or the rapid progression. Emilia's shoes squeaked against the linoleum as she paced, synapses firing. Metabolic disorders. Besides OTC? Yes. Her feet froze mid-step, a forgotten lecture crystallizing in her mind. Copper? Shaw's brow furrowed. Copper? Wilson's disease, Emilia said, puzzle pieces clicking into place. Genetic disorder of copper metabolism. Copper accumulates in the liver, brain, other tissues. Shaw's eyes narrowed to slits. That's rare. 1 in 30,000, Emilia conceded. But it fits. Liver failure, neurological symptoms, and her fingers flew across the tablet screen, searching. Here, his alkaline phosphatase is low, while his other liver enzymes are elevated, classic for Wilson's. Shaw stalked back to the board, writing, Wilson's disease? In capital letters. What about the bleeding, the vascular occlusion? Copper deposition can cause hemolysis destruction of red blood cells, Emilia explained, her pulse quickening as the theory solidified. That could trigger disseminated intravascular coagulation. DIC, Shaw whispered, clotting and bleeding simultaneously. Exactly. Small clots form throughout the body, using up clotting factors and platelets, which leads to bleeding elsewhere. Emilia jabbed a finger at the symptoms listed. It explains the hemorrhage, the thrombocytopenia, and the arterial occlusion. And the paralysis? Copper deposition in the brain and spinal cord, plus reduced blood flow from the arterial occlusion. Shaw's head dipped in consideration. The elevated ammonia? Secondary to liver failure, the liver can't clear ammonia properly. And the seizures? Neurological manifestation of copper toxicity in the brain, plus the hyperammonemia. Shaw stared at the board, then turned to Emilia. It fits, but why now? Wilson's is present from birth. Symptoms usually appear in adolescence or early adulthood, Emilia explained. The copper builds up slowly until it reaches a critical threshold, and the vascutrill could have been the tipping point, adding stress to an already compromised system. What about the bruising his mother mentioned? The falls? Early neurological symptoms, Emilia said. Coordination problems, tremors. They were probably attributed to his autism, but they could have been the first signs of Wilson's. Shaw slammed the cap back onto her marker, decision etched in her posture. How do we confirm? Serum ceruloplasmin levels, urinary copper excretion, slit lamp examination for Kaiser-Fleischer rings, copper deposits in the cornea. Emilia ticked them off on her fingers. But those take time, which Jordan doesn't have, Shaw concluded. Exactly. We need to start treatment now, confirm later. Treatment? Chelation therapy, drugs that bind to copper and help the body excrete it. Emilia met Shaw's gaze head-on. Penicillamine or trientine are first line, zinc acetate as an adjunct. Side effects? Significant. Bone marrow suppression, kidney damage, hypersensitivity reactions. In a patient who's already critically ill, Shaw pointed out. It's a risk, Emilia acknowledged. But without treatment, Wilson's is fatal, especially in fulminant cases like this. Silence stretched between them, taut as a suture. Then Shaw snatched the wall phone, punching numbers with sharp jabs. This is Dr. Shaw. I need penicillamine and zinc acetate prepared for immediate administration to a patient in the ICU. She paused, listening. Yes, it's for chelation therapy, suspected Wilson's disease with fulminant hepatic failure. Another pause. I understand it's not on our standard formulary. Call the university hospital if you need to borrow it. This is time sensitive. Her voice cut like a scalpel. And set up for plasma exchange. We need to remove as much copper from his circulation as possible. She slammed the receiver down and turned to Emilia. It's a long shot. But it's our only shot, Emilia replied. Shaw's chin dipped once acknowledgement, perhaps even respect. Let's go talk to his mother. As they exited the differential room, hope and dread churned in Emilia's stomach. Wilson's disease was treatable if caught early, but Jordan's case had already ravaged his young body. Even with proper treatment, his chances hung by a thread. Still, a thread was better than nothing. And for the first time since Jordan had crashed through the ER doors, they had a diagnosis that connected all the scattered dots, a coherent theory, a battle plan. She quickened her stride to match Shaw's long-legged pace, mind racing ahead to the challenges looming before them. The treatment would be brutal, recovery, if it came at all, a marathon. But they had named the enemy. They could fight it. Ahead, Marla Hall paced outside her son's ICU room, worry carving lines into her face. She looked up as they approached, hope and terror battling in her eyes. Do you know what's happening to my son? She pleaded. Shaw's gaze slid to Emilia, a silent invitation to lead. Emilia stepped forward, the weight of their fragile diagnosis steady in her hands. For the first time since crossing Baltimore General's threshold, certainty flowed through her veins. Whatever happened next, she knew they were making the right call.